Hello and good evening. This is the Meet ETV show. I'm Tafarra Gadamu. It's now 40 years since the Lions Club established its office here in Ethiopia, and the club's 11th All-African Conference was held in Addis on the 17th of this month, bringing together a number of members. The club is recognized for its efforts in tackling blindness. What else? My guest tonight, Dr.Tibebe Yemaneh Berhan, is the Goodwill Ambassador for the Lions Clubs International. Welcome to this program.
Thank you.
It's interesting. This is the first time that you played the host to your club's international conference.
Yes, that's true. Previously, only we host the district convention. That's only for 4 African countries: Kenya, Uganda, Tanzania, and Ethiopia.
Period.
Yeah. This African conference is the first time. One, because the reason in Ethiopia have only 5 clubs. These 5 clubs were not given a chance to organize such big conference. The previous 10 conferences attended less than 30% of the district governors, plus 150 the maximum registered delegates from all over Africa. Now this 11th one has been assigned to be the biggest one by participants. Second, to bring at least over 60% of the district governors from Anglophone and Francophone countries. The reason is why is the international president of the Lions Club International and the vice president and number of other executive office members will attend this conference. And we take the commitment, and we, from the beginning, we show our commitment in terms of program, how we are going to attract all these African delegates to come to Addis Ababa, and the Ethiopian Airlines conveniency to fly from all over Africa to Addis Ababa, our conference hall, and the commitment of the Ethiopian government to support this conference from the beginning.
So you had 400 plus
Yes.
participants in this conference, mainly from Africa. Well, from Africa exclusively, but you have also the international participants from elsewhere.
Yes, that's true. The African delegates threefold increase the participation, and also 70% of the district governors from all of African countries participate. Apart from that, we had a big delegate from Italy, the Italian Lions, who are working with us in the water project, and delegate from America, Asia, and almost except Australia, from all over the world. But the number of delegates coming from African countries is threefold increased, and for the first time, the Francophones and the North Africa participated in this conference.
So you were able to bring together members who wouldn't otherwise
Get together for the last 10 years. This is historical. Even the slogan of the conference, history in making, we prove it to the rest of the world that we did. Because the last 1 year, we are always in communication with all African governors, alliance governors, to convince them to come and to participate in this conference, and by explaining to them the program motto, the program details, and at the same time also the simultaneous translation. It has been provided a simultaneous translation for the first time.
So what makes, I mean, other than the number of people that you've brought here, what makes it unique? Your commitment in the year 2020, you said you're going to, well, I'm talking from the Ethiopian side.
Okay.
You have this commitment to, or vision, to address the problems of blindness. In other words, there would never be blindness by 2020. That's a very ambitious program. Not only ambitious, but this cannot be achieved.
Yes, I agree with you one way, but I disagree in another way. Just to come back to the importance of this conference, from the beginning, when they decided to give us this chance, Ethiopia's commitment on the blindness eradication program, especially the Lions, what we achieved for the last 10 years with 5 clubs, so tremendous. This experience must be shared with other Lions clubs. Second, Ethiopia, for the first time, Ethiopian Lions introduced partnership with other organization, NGOs working in this field. And our partnership with other organizations so fruitful for the last 5-6 years. We achieved a lot of achievement. And this is one of the reasons why we were given this chance, even though we have only 5 clubs. And this unique conference, for the first time, the international president of the Lions Club attended, the second vice president, and 2 board of directors, and 2 past international presidents, and number of past international directors. This has never been practiced in this for the last 10 years. And apart from that,
could that be a guarantee that you're going to address the problem of blindness by 2020, which is basically next door?
Yes, so far we address 7 million people in Ethiopia, 7 million people directly or indirectly getting benefits from the Lions Club or through our partnerships with the Carter Center. As it is known that the Carter Center is implementing this program in trachoma project area and onchocerciasis or river blindness, fully, I repeat, fully financially supported by the Lions Club International.
Interesting. So you build makeshift clinics on location and then give the treatment. How do you go about it?
We actually address this issue from all angles, by manpower development. At Alert Hospital, we are training 20 nurses minimum per year. We train for the last 4 years. This is the 5th year. Even though when this program is going to be completed next year, we assure to the Ministry of Health we are going to support another 5 years this program to continue, because we need these people to go to the villages and small cities to provide their service. Apart from that, with Christopher Blind Mission, CBM, we build secondary eye units in Bahar Dar, Debre Birhan, Jijjiga, and Arba Minch. Even recently inaugurated the Jimma Eye Hospital, we have a bigger share of collaboration with Christopher Blind Mission. And most of the monies came from Lions from Europe. And apart from that, we have also ambition now to build another secondary eye unit in Adigrat, and to continue also to supporting and strengthening the existing eye departments in different hospitals. For example, Ras Desta Hospital, recently we renovated the whole department, and we are now providing them with the latest equipment for the eye department, such as we did in the Alert Hospital. By the way, the Alert Eye Department also built by the Lions, and also the St. Paul's Hospital. This is capacity building. When you go to the field, we do a cataract operation with the help of Ministry of Health and regional health bureaus. By this year, until this year, we do 6,000 cataract operation. And from this year onwards, we are going to do 10,000 cataract operation. That means every month, it will be an eye camp organized by the Lions Club International.
How do you select the locations where you provide your services?
That's a very good question. This is one of the biggest achievements of the Lions of Ethiopia. We don't select the area. We work hand with hand Ministry of Health. The Ministry of Health selects the place, provide us with the doctors, and provide us with the facilities.
And what do you come with?
We come with a medication per diem for the medical personnel, and the rest of it. It's a combination work. And we pay also for the transportation of medical personnel. And we support the patient when they are coming for their operation in the specific place. And you do also advertisements in the radio and the newspaper. That also, as you know, in this country still we are paying, even though it's a service organization.
And how many people are there waiting for you to help them with their blindness or near blindness? 500,000 plus?
It's over 500,000. Those already the backlog of cataract is over 500,000. To make a meaningful change on the cataract problem, it must be done at least 120,000 cataract operation. But now, even though we increase our number by 4,000, the efforts put by all NGOs and Ministry of Health might not do more than 35 or 40,000 cataract operation. It must be done something on this area. But another area where we are now overwhelmingly satisfied with the trachoma project area. The trachoma project area is now with the Carter Center we are doing in the Amhara region. Our vision to expand it to Oromia and to the further to the South Northern nationality area. And in totally, for the coming 5 years, at least 20 million people must be addressed by our project. If you do that, The Lions Club is not only organization. There are other organizations. They must also, bringing their effort together. And by the year 2020, at least to reduce trachoma to the level of not a public health problem, less than 1 per 1,000.
Through your eye clinics?
Not only to the campaign, because trachoma is we do it in the field, because trachoma cannot be done with the operation. It must be distribution of antibiotics, improvement of hygiene, improvement of water supplies. It's a component of safe strategy.
How would that be possible with the degree of poverty that we find ourselves in this country?
Oh, the problem is if we do some project without the involvement of the public, grassroots level, you'll not be successful. But look our success, what we achieved. We're supposed to do only 10,000 latrines in our project area. Only 10,000. What we achieved, 120,000 latrines we did. Why? We explained to the public. The public was a part and parcel of the project, and they understood the use of these latrines improve their life, not only for eradication of trachoma, for other also communicable diseases, and also improve the environmental condition. And the people, they duplicated what we have done by themselves. Even in some wardas, in some kabbales, the competition was by the latrines. How many latrines has been produced by kabbale? And we show them the direction, and now they are doing it. The most important thing, when you go to the grassroots level, make them a part and parcel of the project. We are overwhelmed with this result.
You've succeeded in doing that?
Yes, we succeeded. Now we are succeeding also developing the spring waters. We spend only 300,000 euro. We get it from the Christopher Blind Mission to improve the water supplies in that area. By providing this pure water, we are not only improving the rate of trachoma, but we are at the same time we are solving waterborne diseases. And the public, when they see that their children are not sick by drinking this water and that, they keep it clean. And the education program also is incorporated in the curriculum. And in the curriculum, we teach, we have a booklet which has been produced, the transmission of trachoma, how to avoid it, hand washing, face washing. This is incorporated in the hygiene education, in the syllabus. And our cadres are the students. And they go to their home and the areas, and they teach the community.
But also the target should be women, right? Girls,
of course, the disease of trachoma is a woman and a child. And the target's also, of course, is them. And
also as agents of change.
Of course. That's beyond our imagination. Most of the changes came to that area through the women. And also, we address this issue by recruiting the community health workers, mostly from the women, and also they participate in the distribution of antibiotic, the participation of the health education, and so forth.
Do you undertake follow-up works, like, for example, when you come up with your interventions?
Yes.
Or is this a one-time job?
No, it's not one-time job. It's a continuation. It's a continuation program. The Carter Center, they implement the project. We, the Lions, we assess the result and sustainability. The most important is sustainability. And in all areas where we provide pure water, we do it as a participation of the public. And you can go to any of the water boreholes drilled by the Lions. Still are functional, even those who are done 10 years ago. They maintain it properly and they follow it because the community is a part and parcel from the beginning. We don't impose the project on the public. First, we discuss with them the needs and where and how to do it, and also how to make it sustainable by doing some small amount of payment for the water which is taken by the community, and that small amount of money gathered, they collected, and they use it for maintenance purposes.
So that's functional. That's what you're saying. But community-owned projects could fail easily. I'm thinking in terms of involving the private sector. Have you thought about that? involving the private sector into your own projects?
We are, by definition, we are private sectors. All of us, we are professional. We do this as, call it as a hobby or as a commitment to the country in our spare time.
But I mean, the private sector actually handling these kinds of projects, part private, part public kind of. I'm talking about private-public partnership.
Yes.
All of sorts.
We have partnership with Carter Center. We pay for that partnership for implementation some sort of administration fee, because they don't do it free for us. Now we are going to start with the World Bank with a graduate document, the same thing. But to have a partnership with a private organization, the administration cost is very high, and you cannot afford to do that, because the money which is collected by the alliance, either from the members or from the good wishers, this money must be implemented actively to the project. And we are also accountable to the public, from where we gather this money at the end of the day. And our partners, also the Ministry of Health, look at the cataract operation we do. Even though we provide all the money, the medicine, the equipment, and everything for that eye camp, the Ministry of Health, by providing the hospital, they pay for the electricity, they pay for the water, and sometimes even they give us transportation, even though we pay for the fuel. But it's a combination, and the work must be done by the Ministry of Health. But we are complementing and assisting the Ministry of Health to do this job, because they don't have the resources to do. This kind of combined work must be expanded in all spheres of the development. As you see, in any given country in the world, without participation of the civic organization, there is not any development, because we are the voice of the people. We are addressing some issues which is burning, which cannot be done by the government because of lack of resources, and so forth and so forth. We are coming to that picture to do that project and assisting the government agencies, and with the collaboration of the government agencies or with other partners, which I already say, Carter Center, CBM, World Vision, and so forth, and we are delivering the goods. And the most important thing is not to forget the public. Unless the public is aware what we are doing, without the support of the public, there is no anything can be done.
How can the public be aware of what you're doing? Because in 40 years, you have only 5 clubs?
Yes, that's a very crucial question. You know, not to forget the military regime time. At that time, before 1974, we had 13 clubs in the country, including, I can tell you, Agaro, Jimma. Now, the military government, they came to the power, they nationalized everything, and most of the people are in the Lions Club was owning the factories or the small-scale industries and so forth. They left the country. And only one club left in Addis Ababa. This club was nearly to close here. Even the Rotary Club has been closed. What is saving us when the drought has been devastating this country? We're able to bring one aircraft from Sweden, from the help of Swedish Lions Club, and you give to the government to transport the foods to the northern part of Ethiopia.
So you prosper like other NGOs on drought and famines in this country?
No. We don't. It's not a part of our activity, but we see the transportation at that time is very difficult. We want to make an impact on this, to do something. And then you get this plane, and you give to the government, and they allow to continue that club. That is the only club survives the communist regime. Thanks to the change of the policy in this country after 1992, that we're able to start growing to the 5 clubs.
But even then, you are a club of, this is a club for elites.
It's not a club for elites.
You have ordinary people.
Yes, ordinary people. Let's define it this way. To be a lion, someone must have money to share his money to the needy.
How much?
It's not, at least he must pay international and district dues. That's mounting $50 per year. plus club dues, which might be equal, to run the club. And plus, on the meetings, he must support his own expenses. But still you are correct. Still, loudly you are correct. Why? Because in Ethiopia, it's not 160 people are there affording this. Can be 10,000 people can do this. There are millionaires and millionaires here in this country. When we ask them to join the Lions Club, the first questions they are asking us, what is my benefit? They forget that they learn, they go to school, they achieve up to this level through the public participation. The public is paying the tax. And you must be able to pay back to the public, at least by doing this kind of small activities. It's not a big activity. In other countries, even they committed this kind of people hundreds of thousands of birrs or dollars to support this kind of activity.
So where is the problem?
The problem is awareness. Awareness. Sometimes greed. Everybody is asking, what is my share if I become a member of this organization? This is not a formula. We must pay back what we have already taken from the community. We are to some level of achievement in our life. What was the people, the poor of the poorest? Who's going to look after them? The government? There is no way. Forget in Africa. Even in other world, the government cannot address everybody. The people, they must organize themselves and go to the community and try to solve the problem. Why we are now organizing the Boy Scouts from the beginning, from the childhood, that they have a sense of community belonging. And unless we do this community belonging and start helping the people, first of all, we cannot understand even the scope of the problem in the country. And we'll go to the negative side. Whenever an issue is coming or shortcoming in the political or economical situation in the country, always you go with a negative attitude. So if you come through this community service, first of all, you start looking to any issue from the positive sides. And you try to bring the positive sides more bigger than the negative sides. Nobody can build a country with a negative point. There is a shortcoming everywhere. It is obvious. But how we are going to change this world? Only positively. And if you start do something and committed to do something, and you'll understand also the other part, the difficulty, how to do positive things and to change the community. And we are not only doing a work, we are preparing leaders. The change, you can see it before they become the Alliance member, and after 5 or 6 years, people completely change it in their attitude to solve the problem, and also the skill, how to change it. Even simple example I will give you. This conference, which is just concluded, we didn't hire any professionals. We did it by ourselves. Even some of the people who were participating and helping us, they were wondered how is professionally this conference was organized. But people are learning the process in their life. And this experience and learning issue can be implemented in their daily activity, day-to-day activity. And this is also another part of the issue.
Do you have plans to increase the number of clubs in this country?
Yes.
Do you have a timetable?
We have a timetable. Even though we tried in the past to increase it, maybe some of the issues is a bottleneck. Like 2 of the clubs are meeting in the Hilton Sheraton, might be the problem. And now the clubs can meet anywhere. And we translated all the books in Amharic. It has been launched now during the conference. The literature is available in Amharic. We can open it anywhere in the world. In the country. Now we are going to open 1 club in Mekelle. And in very near future, maybe we will open 10 or 15 clubs in Addis Ababa. The community must come forward. Because even out of these 5 clubs, 60% of the members are foreigners. Whereas the Ethiopians only 40% out of this membership. The membership issue is very, very vital. Even the point we discussed in the African conference. 18,000 members in Africa for 750 million population. That's impossible to give the service. Africa must awake. The lion of Africa must awake. If you want to change this condition, you must be at least 180,000 members to do some tangible service to the community. And this kind of tradition must grow. Unless otherwise, it's impossible. I mean, to wait until the government is doing everything.
Can the African Union be the way that could perhaps lead to increasing the number of members for your clubs?
The African Union, the civic charter is similar to the Lions Club, and we do the same thing in part and parcel. Of course, the African Union will be instrumental to increase the membership in African Union because, first of all, role model is very important. These kind of things, people when they see somebody is achieving some level of achievement, they might follow, and sometimes people are not joining this kind of clubs because they have misconceptions, misinformed, and the role of media also is very, very important. And if the media propagate on this kind of civic organization and give a continuous education and information, we can change the community completely.
But for a start, why don't you seek an observer status within the African Union, like other civic organizations and NGOs?
Already we apply for that according to the charter. We are waiting until it is going to be accepted. We hope it will be accepted. That is not only one thing. You know, to change the community or anything, the information provided is very important. And also the role of the mass media in African countries, they must change. And they must become friendly to the civic organization like Lions. Even I provide you some information and session. Look, the last week what we have done in this country. It's a tremendous job. We are in the prime of news, and people were asking from left and right, and everybody was concerned about the Lions movement. But unfortunately, in this country, we do it temporarily for some period of time in the year. But we must have a continuation program. Some program must be dedicated for this kind of activity. And continuously, if you give the information, if you're not able to change the whole population, at least some, and gradually you can grow. I'm a positive thinker, and I always appreciate it, and I know the power of media. The media can change what we are having. Without media, how many people you can address? Everything is expensive. To call a meeting, to address each and every individual, and it takes time also. But media can address one time big number of population and effectively, and can work. This project can be developed together.
Well, you have the opportunity. Thank you very much for coming to talk to me. It was a pleasure.